All right, perfect. So thank you everybody for coming to Awaken Thriving podcast. We have with us today Dr. Brendan Armm. He is a doctor of acupuncture and Chinese medicinal herbalist. He's a diplomat in Oriental medicine. He's a founder of Lotus Integrative Medicine in Santa Monica. He has a doctorate in orthopedics, pain management, and primary care integrative medicine. He has additional training in Ayurvedic medicine from Mysore, India. All right. Welcome, Dr. Armm. We chatted a little bit before this, and I'm actually really happy to have you on. I looked at your website a few months ago, probably about like 4 or 5 months ago. I was like, that is like a really great center, and I really wanted to chat with you guys a little bit more about what you do, especially acupuncture. I've had acupuncture before, and I've spoken to a lot of people in my circle of Western medicine, and some of them just aren't that open to it yet. And I feel like they're just afraid of the needles. But I like want to hear from you, because I can tell them so much. I'm like, you could do it. Like, it's amazing. But hearing from you, I think would be so much more helpful for them just to try it out.
Oh, thank you. Well, thank you for having me. I'm looking forward to sharing whatever I can.
Yes, definitely. So you grew up in Connecticut, right?
That's right, Andria. Yep.
And then let's see, and you went to Yale. You did research at Yale for a little bit, and then it looks like you traveled to India, right?
Right. Well, undergrad, I went to Wesleyan University, which is about 20 minutes north of Yale, which is in New Haven, Connecticut. And that's where I did my undergraduate. And I studied in pre-med, and I also studied in world music. I did a double major. I was interested in both.
Oh.
I come from a family of different doctors, and that was the path I found myself on from a very young age. And somewhere in college, I went through the whole pre-med track, going into medical school. I just decided, well, let's see what other things are interesting to me in the perspective of healthcare.
Mm-hmm.
So before starting medical school, I did do research for some time at Yale, studying particular dermatology and immunology.
Mm-hmm.
But then I paused, and I decided to go to India for 6 months.
Oh, wow.
And for me, that was a trip that I had been planning for many years. But the perspective of it was more of a spiritual one, to take a pause on medicine to see if going into cardiology, which is what I was interested in at the time, would be the path forward for me, or if there was something else. So I did study for a while in Mysore, which is in southern India, with an Ayurvedic teacher. The history and philosophy, and the background of what Ayurveda is. I was also very interested, and I continue to this day be very interested in meditation practices. So I went to visit and stay at different ashrams for quite a long time, in total about 6 months, studying meditation and studying spirituality.
Okay.
There were a few teachers of mine that were most inspiring. I studied for a while meditation with Amma, or Amachi. She's also known as the Hugging Saint. She's a very special lady.
I've read about her.
Yeah, she's a very special woman. Yep. And her
Gosh, that's amazing.
Yeah, her interests are certainly about selfless service and helping people. So that resonated for me in my interest with medicine. And then also I spent some time studying with the Dalai Lama up in Dharamsala, which is in northwestern part of India. His interest is more towards compassion and tolerance and understanding, which again kind of mirrored my interests in medicine, and some other teachers as well. And when I came back, I decided I'm ready for medicine, but what options are there to be a doctor in the United States that can offer something that isn't just body, but also can do mind and spirit? Because that's what, when you talk about what is integrative medicine, some people translate it as you're integrating the best of both Eastern and Western modalities, because they both have a lot to offer and they both have shortcomings, but it's the integration of the two of them which can, is what we refer to when someone says, well, what is integrative medicine or holistic medicine? But some other interpretations of what is holistic or integrative medicine would include, a medicine type that joins together body, mind, and spirit. So it integrates all three. And that's how I essentially found my way into Chinese medicine and acupuncture.
Okay.
In addition to having my own experiences with acupuncture from a young age, having a very positive experience with acupuncture, treating my own chronic migraines, and it's been very helpful. So that's how I got into the short story of how I got into Chinese medicine.
Wow, that's amazing.
Yeah.
So you had acupuncture before when you were younger?
Yeah, I didn't know what it was at the time. I was a child, and my family it's in my family as well, migraines. And I tried everything. I tried allergists, neurologists, pain management specialists, different medications, a lot of different things over several years. Diet as well. And there was a practitioner I went to at some point who taught me acupressure points. I didn't know what they were at the time. I didn't even know they were called acupressure points. I just thought them as massage points on my hand, or things like this. And she says, I recommend that you massage this special point. It should be helpful on your hand to treat pain anywhere in the body, including migraines. And did that for a while, and I forgot about it. And then many, many years later, when I got back into Chinese, found my interest in Chinese medicine, I said, oh, that's right. This was actually one of the most effective things myself for my own health ailments.
Oh, wow.
Yeah,
Okay. And so you moved to this area from Connecticut for acupuncture.
that's right.
Okay.
Yeah,
And
I moved here around 2000, 2001. And I moved out here because one of the country's best Chinese medical schools is, when I went to, is called Emperor's College. It's in Los Angeles and Santa Monica, and that's where I ended up. I moved out here to go to that school, and I did their 4-year master's program and graduated in 2005. And then I continued on for past the 4-year degree. I did another 2-year training to get the doctorate level, which specializes in integrative medicine and primary care and orthopedics and pain management.
okay, you have I'm really impressed. I love that you really do embody the integrative medicine. Just reading through everything, I was like, this is how all of our doctors should be. Even
Oh, bless your heart.
like really, I really do believe that. So I'm super happy to have you on. I wanted to chat with you just a little bit before we get into kind of what patients should expect during a visit with you, because I've had acupuncture experiences as well, and they were great. Like I've always had really good experiences with acupuncturists. But I just wanted to find out, what is the difference between Oriental medicine and Ayurvedic? Can you
Great
tell me
question.
just like a little bit?
Yeah, well, these are throughout the world. There's different systems of medicine. In Western cultures, we have the Western allopathic system of medicine, which is very comprehensive, a few hundred years old, things like this, and based on practices before that. Chinese medicine is a whole system of medicine that comes originally from China,
Mm-hmm.
spread through Japan, Korea, Taiwan, and different cultures in Asia, and is spread into Australia and Europe and the U.S. and things like this. But it comes from originally, thinking about, well, there's different theories on when it started, but let's just say it started from Asia
Okay.
or China.
Mm.
Um, and the system of medicine has a very, very much of a Western perspective. In fact, when acupuncturists, and I'm a licensed acupuncturist in the state of California, and also have a national certification, throughout the United States. But the training in California, half of it is just Western medicine, just so that we can communicate with Western patients, Western doctors, understand the medications they're taking, and try to be of service. So half our education is just Western.
Mm.
The other half is kind of a combination of acupuncture, which, by the way, sometimes people get nervous, say, oh, but I don't like needles. A very simple way to think about it is, well, most cases, you don't really feel anything, when the points go in.
Yeah.
Mostly just painless when the points go in, sometimes a little prick. But years ago, we stopped even calling them really acupuncture needles. We just call them points. which
Mm.
even for the patient is a much less threatening term of saying, oh, we're going to put these points in, than saying we're going to put needles in, because they
Yeah,
really are just like little points, and most of them you don't even feel.
sure.
So half the, of that half that's more the uh, non-Western, it's the acupuncture
Mm.
and Chinese herbalism, which is a very, very big system of medicine and very important in the culture of China, of herbalism. Everybody takes herbs. Everybody's grandmother, grandfather, knows about herbalism, takes herbalism. You go to a Chinese medicine hospital, and I've studied for a few months in various Chinese medicine hospitals that are very Western, by the way,
Mm.
surgeries, Western medicine practices. And most of them, Nanjing, Shanghai, Beijing, you know, these major hospitals have on the ground level uh, uh, huge herbal dispensaries. So like you go get your surgery, Western surgery, and, by the surgeon, you may get, the surgery done. And then someone comes in and puts acupuncture points, maybe around the borders of the surgery to help the healing process. And then you get herbs, Chinese herbalism to help the healing process. A lot of times in Western medicine, they have that great approach for, um, imagings and stuff like this, and the you know urgent care or surgery, stuff like this. But a lot of the underlying healing, the strengthening up the body, a bit of that's missing.
Yeah.
So to make a long story slightly longer, uh, that the Chinese medicine is the acupuncture and the herbalism,
Mm.
along with the Western. I mean, there's also Tui Na, which is like a Chinese massage. There's also moxibustion, which is a big deal, which is you're burning like this herb, which is a mugwort herb, and that has various that has various usage. For help strengthen the digestion, helping strengthen the immune system, help with pain management, arthritis, a lot of different indications. But all those different modalities, moxa, you know, Tui Na, which is that massage, is in gua sha, like a scraping technique. These are all on the Chinese medicine umbrella.
Okay.
Ayurveda, that's a system that comes more from India.
Yeah.
And that one doesn't talk so much about the acupuncture meridians, the 12 different channels, like the lung channel and the heart channel, and energy or vital force and chi moving through channels and trying to work on unblocking chi or strengthening chi. That's more the Chinese medicine. The
Mm.
Ayurveda is more, let's look at your constitution and try to identify what type of a dosha or what type of imbalances you have. They often talk about vata, pitta, and kapha. These are three different doshas or body types, and there's different imbalances, and there's different herbal remedies, and there's different treatment strategies like Shirodara, which is like a different strategies of how to treat,
Mm.
um, that it come from its own comprehensive system of and background. But again, that's more of an India. So that's like a little snippet of what's the difference between Ayurvedic and Chinese medicine.
Yeah, I
Both
wondered
medical
that.
systems, just and both certainly share, but comes from two different backgrounds.
Okay, perfect. Thank you. I really needed that discussion a little bit to try to figure out the difference between those. And then, so let's go to a visit with you, like a first visit with you. With your background, I'd love to hear, what do you expect? What does somebody expect when they come in to see you for the very first time?
Oh, great question. Thanks. Well, some people have never seen an acupuncturist before. Some
Mm.
people have. Nowadays, I find more and more patients as the years continue and information gets more spread out and more studies, especially for the efficacy of Chinese medicine, are done here in the United States. And, different insurance policies are covering it better, and Medicare, and, it's being integrated into the
Yeah.
Western system.
Yeah.
I see more medical doctors and healthcare professionals very interested,
Mhm.
going back for education. I hear about it being taught more in the medical schools settings. So medical doctors are becoming much more not just tolerant, but excited and interested and curious
Yeah.
about what is this stuff. It's been around for 2,000, 2,600 years. Some
Yeah.
would say 5,000, some would say longer. Is there anything? I've heard all this anecdotal evidence from my patients. Is the Western medical doctor saying
Yeah.
how helpful it is? You know, uh, what's going on? So
Yeah.
they seem to be interested. So when someone comes into me, um,
If they're brand new, they've never
They're
seen.
brand new and they've never had acupuncture before. We have a pretty comprehensive initial patient, like a patient history that they fill out. It's got a lot of information and they a lot of questions, and they write down all the information. And I spend a lot of time going over each one of those sets of new patient forms. And I actually type it all in because I want to kind of ingest it and take it in. I type and I consolidate all the stuff that they said into like a one screen on my computer. And then I can start organizing, this is here, and I can highlight, well, that's interesting, or I want to find out more about this, or I'm starting to put the pieces of the puzzle together. And for anyone who's interested in medicine, especially Chinese medicine, it's very helpful to have an innate interest in puzzles. Because
Oh,
if you're,
okay.
Chinese medicine, if they have got this symptom and this symptom and this symptom and this symptom, then that can start to point to what kind of underlying imbalance there is. So you have to sort of take all these different pieces of what they fill out, and then you can ask more questions. And then you start to, you don't just say, oh, this person has diabetes, and then put 50 people into the category of diabetes. You see the person as, well, this individual has a diagnosis of diabetes, and these are all the presenting symptoms. And I may end up putting these 50 different patients that have different symptoms, and I might treat them each a little bit differently based on the symptoms. It's a symptoms-based approach of treating, not just treating the symptom, but taking all the symptoms and then putting that together to try to find out where the underlying imbalance is.
Okay.
And that's where we treat. So when they come in, they fill out that form. Then I go over it. Then we have, a consultation. Consultations usually run a half an hour to an hour each on the first time when they come in. And then I, do my own objective findings, which means, right, we look at the tongue. In Chinese medicine, that's something we do. That's part of our diagnostic testing, is we look at the tongue, not just on the first visit, but every time someone comes in. And we look at their pulse. We do something called pulse diagnosis. So the tongue, has all kinds of information: the color of the tongue, the coating on the tongue, are there patches on the tongue, the quality of the tongue. There's, where are these different patches? Is it swollen? Is it greasy? Is it dry? Is it all kinds of
How about
information?
people
Is it
that scrape
geographic?
their tongue? Will that affect it?
It would. It would. It would take away the coating, which tells me some more information. It's not a crystal ball.
Yeah.
The tongue and pulse is not a crystal ball, but there's a lot of information that I can gather just from the tongue. And same thing with the pulse. I'm not just looking at the pulse rate. I'm looking at the quality of the pulse at several different positions. There's 3 different positions on the right wrist, and there's 3 different positions on the left wrist, and there's different depths. And that gives me, again, more information to collect. And then if it's missing the coat, well, I'm missing that point, that part, but I still got a lot more. And then I put that all together and I come up with a Chinese medicine diagnosis. And then from that, we come up with a Chinese medicine treatment strategy.
Okay.
And from that, then I start choosing the acupuncture points. And usually I put in somewhere between high teens, like 16, 18 points to low 20s. That's pretty typical. And not everybody gets acupuncture points. And some people, like them in a long time. Some people like them in very short. Some people only want a few points. And, we work with the patients, individualized medicine. So you put the points in, you have them rest with the points in, hopefully 20, 25, or even more, maybe 30, hopefully, or even 30 minutes. It's good to have them in at least 25, 30 minutes if they're comfortable. You try to make it very comfortable. They're laying down, they're clothes, all their clothes are on. There's nice heat lamps that have these Chinese herbs in it. So it's not just warm, but there's some kind of, like, it just feels good. The heat lamps, everybody likes those. You put the points in, you put on some very peaceful, etheric music. They have a little bell. So if they're uncomfortable, they can always ring the bell and I can know that they need something. You turn the lights down and you leave them in their private room and let them just balance.
Yeah.
Let their body find homeostasis. The
Okay.
better we can do that, the more the body is in a state of homeostasis, the better the body's ability to heal itself.
Yeah.
And then that's the acupuncture and the herbs. And based on our interview, if the patient is open to it, we'll prepare a Chinese herbal formula.
Okay.
Sometimes that'll be a patent, meaning it's a tablet or capsule. Other times it's a tincture, like it's an alcohol-based tincture that you put in your mouth or in some water and drink it. Other times it's a powdered formula. We have a whole herbal dispensary in our office where we mix 6 grams of this, 8 grams of that, 10 grams of this, and we make somebody a custom herbal formula in a powder that's already been, individually, each herb was cooked, then freeze dried, then dehydrated into powder. So you're mixing these powders, and I put it into a container, and they take, depending on various factors, their age, their weight, how sensitive they are, a certain dosage, and depending on the disorder, depends on, you have to make some type of differentiation, how frequently, and then they drink this as a hot tea each day. And lastly, there's, typically a list of, patient instructions, that are generally lifestyle instructions. Maybe have to do something with exercise or sleep pattern or stress management pattern or diet or nutrition, or some other resources or references that might be helpful for them, and I make a list of that, and I typically will print it out for the patient, and I give it to them, we discuss it. And then and I have a copy too. So when they come back, we say, hey, let's check in on, like, I know we were working on getting you from 12 o'clock to 11 o'clock getting to bed. How'd we do this week? You try to be reasonable, people. Some things, there may be a whole list of things, but you try to work with the person and make some recommendations, especially diet and nutrition. There's some wonderful information from Chinese medicine about diet and nutrition, and you take it step by step. And then depending on the case, they follow up. Some patients, it's not uncommon, they'll come back for follow-ups once or twice a week for the first few weeks, and then after that they start to wean down, once every week or less frequently, or in some cases just a few treatments and that's it. In other cases, they need to come in more regularly for a period of time. And in some cases, you're working with people for years and years on chronic issues, and they may come and go and things like that. So we have all kinds of patients like that. But that's what a session's like.
Wow, I feel like I need to have one of those sessions, because I've seen an acupuncturist before, and she was wonderful. She was wonderful. I did get some tablets dispensed to me afterwards. It was for stress management, but yours just seems a little bit more in depth. I like that.
Everybody practices a little differently too.
Yeah, and she was wonderful. I think she's an amazing acupuncturist as well. She's in LA area, so. But I think I will be heading over there. I'm gonna have to make an appointment. Let's see. The tongue thing's very interesting to me. I want to stick out my tongue, but I'm not going to.
When we do telemedicine, that's how it works. We usually have them go right to the camera and show us your tongue. And there's a little embarrassment at first, but it's very interesting. And if you explore into Chinese medicine, there's volumes of information on tongue diagnosis and pulse diagnosis, and so many theories that have developed over long periods of time. And that's what I like about Chinese medicine. There's been so many theories, thousands of, countless practitioners. And over time, the better treatment strategies tend to move on from generation to generation. And there's still new stuff coming out every day now. There's all the time new research coming out and new herbs that are being created and new acupuncture points are being created. But there's certain strategies that, again, over centuries or, thousands of years, still herbal formulas we use from thousands of years old just to boost the immune system that are no more relevant today than they were thousands of years ago. I mean, everybody still wants to boost their immune system. And everybody still wants more energy and have less stress in their life. I mean, so some of these oldies but goodies stick around.
Yes, for a good reason.
Yeah, they stick around. And the ones that, people try that maybe didn't get very good results with, they, move on, just like in any other form of, medicine or other.
Yeah, definitely. So can I ask you, do you scrape your tongue?
I don't.
Don't?
Yeah, no. And if someone does, I guess I would say to them, go for it, but maybe don't, because in Ayurveda, as an example, that's something that they say, tongue scraping can be helpful. Chinese medicine doesn't go into that. They would say, if you maybe don't scrape your tongue a day or two before coming in, 24 to 48 hours, because then the coat can kind of grow back to some degree. Again, because the thickness of the coating, the color, like a beautiful analogy in Chinese medicine. They sometimes call it the fur on the tongue, the coating. I know, some of the terms are wonderful terms. The translation is just fantastic. But it's like they've likened it to, you think of grass and how it grows from the earth. If the earth is, and again, this let me point out, Chinese medicine comes from this Taoist concept, this very observation of how nature behaves. A lot of the theories in Chinese medicine mirrors, you know, if there's not enough water or nutrients in the soil, then the grass won't grow. You know, but if you just put some fake grass on top, yeah, but then the dog pees on that, and and then how are you going to get that out, because that's not real grass, it's just sitting there,
Yes,
the
true.
astroturf, whatever. So they say the natural, and this Chinese medicine is more of that natural medicine. They would say you nourish the soil and the grass comes back. So the same thing with that fur or coating on the tongue. If the body is nourished, then you would have a healthy, thin yellow coat on your tongue, normal. If
Okay.
it's very thick and greasy, not good. If it's peeled or not there, not good. Same thing in the earth. If the earth is too swampy and too much, toxicity in it, then it's just this sludge out there. Or if it's too arid and not getting, proper nutrients, then it becomes a desert.
Mm.
So,
So bright pink tongue that has nothing on it, it's not really that normal?
well, they say like a baby's tongue is pretty like an infant or a child's tongue is, and I have two small children, so I look. Um, the coating there is good. The tongue body tends to be good. The coating tends to be good. It's like a thin yellow coat. Yeah, not too greasy, not too dry, not too thick. And the tongue, same thing, not too swollen, not too scalloped is a term that they use. Scallop means that the tongue is swollen, so it starts to press against the teeth and starts to cause these teeth marks or scallop presentation. That points oftentimes to the digestion being weak or the immune system being weak. And we give herbs and we give acupuncture and lifestyle recommendations to treat that. And then we look at the tongue, and then the patient's tongue has less teeth marks and it's less swollen.
Interesting.
Yeah,
I love how we just got off on the tongue. That is very interesting to me, though, because tongue scraping is something that a lot of people do and a lot of people are doing right now. So,
sure.
okay,
And it's not bad. It's not bad from a Chinese perspective, except for that clinically diagnostic point. I can't see the coating if you scrape it off. But
true.
it's not like if you scrape it off, it's going to be detrimental to your, your immune system or your gut health. No, it's
No.
just, I can't clinically get any more information without the coating.
Okay, so we have to keep our coating on. I'll remember that when I come in. I'm like, I'm not going to scrape my tongue for 2 days. All right, perfect. So let's see. What are some common like misconceptions that you think some people may have about acupuncture?
Number one, it hurts. People
Yes.
say, "Oh, I'm scared of needles. I don't do needles."
Yeah.
I'm scared of needles, and I don't do needles. I don't like going to the doctor. We're all familiar with getting those hypodermic needles. You go to the doctor's office for your vaccine or your blood, they draw blood.
Yes. Yes.
Nobody likes that. This is not like that, though. That's a misconception. They're
Yeah.
so thin, these points,
Yeah.
that I mean, some people say, well, the amount that you could fit inside the tube of a normal hypodermic needle, I don't like that one. But I like to say, like your hair, as thin as the hair is, they're that thin. Like these things are, they bend. They don't break. They're stainless steel. And that's another not a misconception, but important thing to know.
Yeah.
In the United States, we don't autoclave or reuse needles, acupuncture
Ooh,
points. Okay, that's
okay.
very important to understand. Just from a clean needle technique, every point is stainless steel. They're solid. They're not hollow. We're not injecting anything in. We're using your energy to heal yourself. I mean, maybe I put the points in and I do a certain technique, to help stimulate, the energy of certain points that send a signal through your nervous system up to your brain that releases certain chemicals that, has a desired effect on the body. That's kind of the neurophysiological perspective of acupuncture. But these points I put in, they're solid, stainless steel, and use them once.
Okay.
And then you take them out, and then you put them to a sharp, container, and then they're disposed of, appropriately, melted down somewhere off site at a disposal place. So you get 18 needles or 18 points in your treatment. There are 18 points that's never been used before and will never be used again.
Okay. That is good to know.
Yeah, but they don't hurt. I mean, occasionally, it's like a little bit of a prick, sure. And communication with the practitioner is very important. Let him know, oh, that one's uncomfortable. Like if a point is a little bit sharp or itchy, you should communicate that to the practitioner. And that means it's activating like a nerve on the surface of the skin that's not very therapeutic. It's just more uncomfortable. But sometimes the point may be a little bit dull, achy, or heavy, or warm, or radiating. That's normal. And the acupuncturist can turn it up or turn it down depending on your comfort level. But most of the points you won't even feel.
Yeah, I've
And
never
that's
felt, only once. I think one I felt, but it was on the tip of my middle toe. But
yeah.
that's,
Well, there are more nerve endings on the fingertips and the toes. Yeah, the hands and feet. Yeah, you'll feel those if anything more than like the belly, legs, or chest, or like your arm, stuff like that.
yeah, I even had some on my face, but
Yeah. Mhm.
I've had quite a lot of acupuncture, but that was the only one out of all the, I'm not sure if it was hundreds that I've had done before.
And we use different size points too. They're different. They call them gauge, how thick they are,
Mm.
and we use different length points as well. How long they are. For example, the ones in the face. The face is so vascularized. We tend to use thinner points, very thin points, so that you don't cause bruising. But bruising can happen, and
Yeah.
patients need to be aware of that. But most times they don't. And then when it is a bruise, it tends to be very superficial. That goes away for a day or two. There's no. It's not. If administered properly, you're not, causing, there's no harm other than the superficial, bruise you got there for a couple of days, but that's pretty rare.
Yeah, definitely. Like I said, I've always had really great experience with acupuncture and acupuncturists in general. So
Yeah.
really,
They tend to be,
really happy to get this info out.
yeah. And they tend to be, the licensure is very rigorous. It's not easy to pass.
Yeah.
And the training is very comprehensive. Again, 4 years training, and I did another 2 years, so 6-year postgraduate training. Making sure, number one, that the patients are safe, and number one, do no harm, and number two, that the practitioner is safe or staff is safe, and then hopefully, having some very helpful therapeutic effects as well.
Yes, definitely.
Yeah.
So I want to ask you about this, but you kind of went over it a little bit in the beginning, which I loved. But I want to just get a better, more focused look into what you think about this. What does bridging between Western and holistic medicine really look like to you? Like, I feel like it looks like what you're doing right now.
Yeah.
Honestly, is that what your vision is?
Yes. I you know, again, both systems, I think, well, I think Western and Chinese medicine both agree to this. Both systems have shortcomings.
Mhm.
Chinese medicine doesn't, you have a broken bone. X-ray is not a part of Chinese medicine, classically. It wasn't invented, as a Chinese medicine modality. X-rays, MRIs, PET scans, brain
Yeah.
imaging, we don't have that.
Yeah.
I need that from Western medicine.
Yes.
And
Yes.
I need medications, there's Western medications that can be very, very helpful, life-saving, and are very necessary. Chinese
Yeah.
medicine doesn't have that.
Hmm.
But you know what? On this other end of the token, when you ask Western practitioners and patients, what can you guys do to help strengthen the body?
Yeah.
What can you help with the immune resiliency? What can we do with someone's, um, diet and nutrition? What can we do with somebody's um, helping to support their system to be stronger? What kind of lifestyle adjustments? They don't get too much into that.
Yeah.
For example, like many acute or milder or moderate things, when somebody has some issue, um, Chinese medicine can be very helpful for.
Yeah.
But again, like acute, urgent emergency care, someone gets into a car accident, they've severed some arteries. I don't want to see them. They get gunshot wounds. Go to the ER. Don't come to me.
Yes.
But after they stitch up those things and help heal them, you want to help the body heal itself. You want to
Mhm.
help support them in their other things they're going. Say they're undergoing chemotherapy and radiation. They're maybe having some side effects of some of these things,
Mhm.
or to help support their system as they go through it. Acupuncture, Chinese medicine can be very helpful with some of those side effects. Someone has dry mouth, someone has pain, someone has, yeah. I mean, even with the opioid, pandemic, we're trying to get these people off these things, but
Yeah.
people are in pain. So
Yes.
what are our options? Well, Chinese medicine uh, has a long history from working with pain management,
Mm.
and maybe you can work in conjunction with a Western medicine doctor, wean down some of these addictive medications and see how they respond to less invasive, with less side effects, treatment strategies like acupuncture and herbs. You have to be very knowledgeable and careful about, drug herb interactions. That's certainly very important. So you need to know what patients are taking in terms of drugs, and you need to be very careful what herbs you give them. And I always give patients, hey, these are some of the things I'm considering. Bring it to your Western doctor, see how they feel about it. A lot of
Yeah.
times they don't know what it is, but I'll happy to share with them more information about that. And a lot of the chronic issues Western medicine struggles with.
Yeah.
They can maybe manage it, but over time, they're struggling with it. Diabetes, hypertension, high cholesterol, hyperlipidemia, some of these issues, autoimmune issues, some of these chronic or degenerative things. That's a very difficult thing to work with in both systems. But Chinese medicine seems to have a lot of strategies on how to support the body to help bring the body back in homeostasis that either slow the progression of a disease or maybe helps somebody get back into better health.
Okay, I love that. I love helping before it gets like really, really bad for diabetes or anything like that.
Yeah.
Sometimes you can't help it. A lot of people don't come to the physician or to a doctor unless it is a really acute
Yeah.
diagnosis
And,
reaction.
and for example, like, again, I come from a Western background, and I'm from Connecticut. So there were no acupuncturists growing up there when I was growing up there. Yeah, I mean, I was the guy in undergraduate school, a part of some pre-med honor society, some thing like this. And I remember an acupuncturist coming to speak to our group, and it was me who turned to my colleague and said, "This is the biggest load of crap I've ever seen." So it was me. So I get that Western perspective, like, what is this? Come on. People change.
Yeah.
They do.
Yeah.
This is what I do for a living now, and I'm fascinated by it. I've been practicing since 2005,
Yeah.
and God willing, for the next 30, 40 years. People change, and Western medicine is changing to be more tolerant and accepting of it, and
Yeah.
interested in and working together.
Yeah.
That's from my perspective. Is that I mean, my office is literally across the street from probably the largest hospital on the west side, Providence St. John's. It's literally across the street. My office is filled with Western medical doctors. I integrate with these guys all the time.
Yeah.
So
I
both
feel like
systems working
our
together.
area, Southern California, all the coasts, like maybe not Connecticut, like New York, we're really progressive in the way our healthcare moves. But like the Midwest and those places, they're not so much familiar with how we're progressing. So I feel like this information is really helpful to them because we're in the middle of it. Like we have access to all these wonderful holistic doctors all the time, but a lot of other people don't. They have to travel to come to get somebody. So
And I have family and friends that live in the Midwest,
yeah,
and they've told me, they travel. They
yeah,
travel to go see their acupuncture because there's not a lot in Idaho or in Kansas. I mean, there's not a lot in Tennessee. That it's hard to find, but I hear too there are great practitioners there.
yeah,
And you
I'm
can
sure.
go on a site called acufinder.com. You can type in your zip code,
Mhm.
and you can get a list of practitioners, in around your surrounding area,
Wow.
or get involved with them. Well, telemedicine is tricky because it really needs to be, at least for right now, an established patient. So starting to work doing a lot of telemedicine with those that I haven't seen established patients is a bit tricky. So but we do a lot of, I have a lot of patients that are bicoastal or that live all over. And when I see them here, then I'll stay in contact with them. We'll do telemedicine. We'll send them out the herbs. Absolutely. I can't administer acupuncture when they're in Australia or when they've gone back to, Nevada or Alabama or things like this. But you can mail them herbs, but you can't do the acupuncture. It's too far away. Um, or yeah, so find someone local would be good.
Yes, definitely. Within maybe about 2 or 3 hours would be ideal. So,
Yeah. Yeah.
so
Maybe, or maybe on a
if,
day that doesn't have too much traffic. You can get there.
yes, I know traffic's been pretty great as of lately.
Yes. Yes.
That'll be changing soon for us, I think. So, what do you think? Is there anything I didn't ask you that I didn't know to ask you about acupuncture that you want to say?
Um, no, I think we covered it quite well. I constantly, meditation is very important to me. It's a practice I do every day. Every morning when I get up, and I recommend to all my patients, I sit at the edge of my bed and I do a mindfulness breathing practice. It helps me to get present. It helps me to come to the day with some positivity, some,
Mhm.
a sense of, vigor.
Yes.
Um, and, you know, from that meditation practice, over the years, I've seen it from China, from me getting more and more uh, deeper into Chinese medicine. It just fascinates me how the medicine mirrors what's happening in the micro and the macro. So the nature, how nature behaves. What happens when a fire comes through, it burns all the trees, and then all the tree, like we had some fires here in California, so, we often do, and it burns all the trees,
Yeah.
and then all the the seeds in the trees fall into the ground,
Yeah.
and somehow it gets into the ground, and then we get this great rain that comes, and there's nothing in the ground, there's nothing that's sprouting, but then the rain comes, and then many, many months later, you see these wildflowers like we haven't seen in years,
Yes. Yes.
like I haven't seen it in many years. So same thing in Chinese medicine, something happens or comes through, and then something else happens, from a not from a mechanical, like treating the body like a machine, like a car, but treating it like an expression of nature. If you nourish it well, then the body seems to do well. If you give it proper rest, if you manage your stress, you have some
Yes.
sort of stress management plan. And if you don't have one, work with a practitioner to get one.
Yes.
Um,
That's
Even
why I went to an
headspace.
acupuncturist, was
What's
for
that?
stress management. That's
Yeah,
why
stress
I
management.
started acupuncture.
Things like this, then you'll see over time these wonderful wildflowers not just grow in nature, but in ourselves.
Yes,
So
definitely.
I constantly get fascinated by that. And I go walk in nature and I feel how healing nature can be, and the oxygen that comes off of the trees and plants, how healing that can be. And that's mirrored in the Chinese medicine system of medicine.
I love that. I about 10 years ago I started meditation, and that was a poignant time for me. That
Mm,
changed the direction of a lot of things that I was doing and choices I was making. They weren't bad, but it just clarifies things for you, I think, a little bit. And then you just keep on building on it or keep on nourishing your body more and more and
yeah.
more. I wish more people would meditate, but I think it's coming along. I think it's coming along a lot farther than it was 10 years ago.
Well, and with technology right now, there's some wonderful apps out there that that makes it much easier to put together a regular practice.
Yeah.
Uh, just a couple blocks down from my office is the headquarters of a company called Headspace,
Yes.
and it's a great app. Download the app, try it. To help put together a mindfulness breathing daily meditation practice. There's great guided practices. There's many resources.
Yes, definitely. And then I read something you about this is just stuff that you're interested in. Um, Sound therapy, aromatherapy.
Crystals, I love them all. Sound therapy. Again, an undergraduate, I mentioned I was interested in, double major, not just pre-med, but I also did, world music. I was particularly interested in percussion and, from the world. And I did history, performance, and theory of music. So music runs through my blood. I studied percussions and drums for decades.
Mm.
Um, it
So
you
you're
know you
musical by nature.
yeah, I mean, you have this euphonious music that you listen to and you're peaceful. You listen to nature, you listen to the ocean, break, and you feel peaceful. Sound therapy,
Yes.
same thing. You listen to cacophonous, somebody yelling or screaming or at somebody, or some of the news you hear on TV, and you get really stressed out.
Yes, yes.
So sound therapy is very important. There's even something called acutonics in Chinese medicine, essentially these different uh, pitch tuning forks, which you can, strike and they make sound. You can put them on the acupuncture points, or you can rattle the points with the sound, or you put on the temples, things like this. I love sound therapy, and I love aromatherapy. I have different vials in each of my treatment rooms of different scents. We all have five senses. Some of us, are particularly stronger at one versus another. Smell is a big one of mine. So, I take in a lot of information, not just through sound and sight, but smell. Patients do too. Different aromatherapy can be helpful for, the nervous system as a sleep aid. My goodness, to awaken and to enliven. I mean, it goes on and on. And crystals too. I like crystals. I don't know, having a good crystal in your office or in your home or in your bedroom or somewhere in your house, that clean light, that brilliant light. I don't know. It's beyond the intellect for me to explain. It just makes me feel good.
Yeah, I do too. I have them too. So I love that. I knew I'd love having you on. You have so much info, and I feel like I just tapped it. But thank you. Thank you for being on with me and just sharing all of your knowledge. It's been wonderful. So,
Oh,
any last words besides come see you?
no, bless your heart. My recommendation is just work with, if you have, it's good to have a partner in your healthcare. It's much easier, the saying in Chinese medicine goes, to build a well when you're not thirsty. So it's easier to stay well when you are well. So work with someone to stay well on some regular basis. If you're not well, then even more important to find a partner to work with that can help you with your health care, so that you can get back into, as best as possible, some health and wellness. That's what I'd recommend.
Okay. All
Yeah.
right. Thank you again. I really appreciate having you on.
Oh, bless your heart. Thanks, Andrea.
Thank you.
Stay well.